Hi everyone, it's Dr. Neville Campbell and welcome back to the show. Today we have Dr. Collin Sewell with us. He is a chiropractic clinician that's a month away from graduating his training and starting clinical practice. This guy's a fitness enthusiast, and when I tell you that his grit, his drive, his determination is one that is next to none. His story is so uncannily similar to mine that it scares me as I hear him tell his story. Ladies and gentlemen, please join me today as we welcome Dr. Collin Sewell.
Thank you for having me.
Thank you for joining us, man. I appreciate you coming.
It's a pleasure being here.
Short notice, but I'm glad you made it.
Thank you. Thank you.
So let's talk briefly, man. When you and I met, it's not too long ago we met.
Yeah.
But it seems like we've known each other for years now.
Exactly.
And and it was so serendipitous. We were talking, about practice in Atlanta, you finishing training where you're about to start working now.
Yeah.
Tell us a little bit about sort of, your journey as to how you've got to the point where you are right now, being a month of graduating from chiropractic training.
What I can tell you is I didn't foresee it looking the way it does right now. I started out thinking I was going to be a lawyer. Started in Jamaica, I was placed into necessarily a class that focused on the humanities, and then my whole life I grew up thinking I want to be a doctor. I want to help with patient care. I want to be in that field. And then I was placed in another class, and I'm like, wow, I didn't feel like I belonged there.
Right.
However, I did try to find the best experience from that, and I was like, okay, I'm going into law. Came overseas, through track and field and all that. And then after being here, I found out I could actually change my major, which was crazy because in Jamaica, you can't change your major in college. And so just being here and being able to do that, I was able to go back on the track I wanted to.
Yeah.
Long story short, essentially did pre-medicine for in my undergrad and was going to do my master's rather in healthcare administration. And my grandma passed, unfortunately, a month before I started. And after she had passed, I was like, you know what, Collin? Go into healthcare where you can be hands-on, where you can really impact people's lives and make changes from the forefront. And so I started chiropractic school because I wanted to cater for patients who are in pain, who are not able to take medications, or who doesn't want to go as invasive as surgery. So I wanted to provide that alternative for them as well.
Wow. Guys, that's very deep. That's a lot. A lot has been said. He's brought us up to speed as to where he started and where he is now. But what I'm really interested in finding out is what happened in between.
Yeah.
Right.
Yeah.
People oftentimes focus on the destination.
Yeah.
But my focus today is on the journey. Right. Let's go back.
Yes.
Let's go back to when you were a child, right?
Mm-hmm.
Looking back from, where you were in Jamaica in small village. You mentioned you were from Reach
District.
Reach District. I'm quite familiar, guys. Reach has a fall, and we used to go and jump off walls as kids.
Yeah.
God knows, thank God we didn't drown, but we used to jump off without supervision, and we had a blast as kids growing up.
Mm-hmm.
But
Yes.
at that time when you're going to, let's say, we call it primary school, here's grade school, and then you go to high school. Did you foresee any of this happening now? If you had to look back and talk to that person, that, let's say, that 11-year-old you,
I did.
and if you had to prepare them for, not where you are now,
Mm-hmm.
but some of the challenges that you encountered, because they had to be challenges.
Oh, yes, they were.
What would you say?
Honestly, so at that age, I did foresee, I've always wanted to be in healthcare. My mom was like, Ryan, when you were growing up, you were always looking in the mirror and having interviews with yourself, just looking back and just, because I've always known that I wanted to be somewhere that I wasn't at that point. I had a bigger vision. I wasn't sure how to get there at that point, but I knew there was something there. And this location where I was in that time wasn't where I wanted, or not where I thought that vision could come alive. And with that, I really had a mom who was a powerhouse. I have to say that she was a powerhouse, and not just to me, but to everyone within the community. So she was that person, and I had her to push me and motivate me along every step of the way. But yes, I did foresee this. How I was going to get here, I had no idea. But by the grace of God, I was able to.
There's so many things to unpack.
Yeah.
So many things to unpack here. I mean, I'm smiling because I remember being in Jamaica too. And again, this is the difference between sort of education in different countries.
Yeah.
The States, I think people oftentimes take for granted the access that is here. though it might not be as, most people want it to be, there's still more access
Mhm.
than a lot of other places in the world.
Yeah.
I remember I was placed too in a single track in high school. And when you said earlier, committed track, if you're placed in a legal track or a medical track, or let's say a trades track, you stay in that track for 4 years.
Yeah.
So, and you can't move
Mhm.
and you don't have a choice to switch that out.
Yeah.
So what if, you're a doctor stuck in a lawyer's body, right?
I agree.
I mean, it does happen, but you're stuck in these tracks. So I'm
Yeah.
glad that, you had the opportunity to come to the States where you could
Yes.
modify and make the change.
Mhm.
But going back to sort of, the small district Jamaica, rural Jamaica,
Yeah.
because I'm from rural Port Antonio,
Yes.
Jamaica, right? Born and raised. People sometimes wonder, Dr. Campbell, you from Jamaica? Don't side eye me. I am from Jamaica. People back up,
Born and
right?
raised.
I can speak. Me can speak Patois too, right?
Yeah, man.
Good to know, right? So people gasp when they look at me crazy. When I shift into, the discussion of oxtails and rice and peas and curry goat, you're like, what's going on here, right? But my roots, I was born and raised.
Yeah.
It wasn't until I was 18 that I left Jamaica. I went to New York City, and of course, just the striking contrast from being on a farm where
Mhm.
you're on dirt roads or no street lights or you're using lanterns, from that
Yeah.
to New York City where you look around and there's light overload. Like everywhere you look, there's lights, there's cars, there's people, and you had to adjust and adapt. Do you think that growing up as a child in your household, you mentioned your mom just now. How did your parents prepare you, really, indirectly for
Yeah.
what you had to deal with, and what you're dealing with now?
So that's a good question because I wasn't blessed to have parents. I had a mom who, my dad he was there physically, but we never had a relationship at all. I wasn't able to get to why we weren't ever able to have that connection. However, I had a mom that really and I always say to her, she played a mom, a father, a sister, an aunt, and she was very multifaceted in that area. And then she always said to me, Ryan, remember the heights by great men reach and kept were not attained by sudden flight, but they while their companions slept were toiling upward through the night. So hey, nothing that is gonna ever come easy. It's gonna always take a lot of hard work. And she instilled so many principles in me as a child growing up and just let me know that hey, you are so much bigger than where you are. And honestly, I'm so grateful for her and some tough love that I had to get. So
Yeah.
yeah.
Thanks for sharing, man. Just
Yeah.
thinking about, you mentioned your parents, your structure, your household. Dad was there, but he wasn't there.
Wasn't physically. Yeah.
And when you say he wasn't, so physically he's there. So you're saying that someone can be present
Mhm.
physically in the household,
Yeah. Oh yeah.
but they are not there.
Not there.
In what ways that you wish your father was there for you?
Wow. And again, that's another good question. It's just growing up in the community and seeing people with their dads and even watching movies and seeing how people interacted with their fathers and hey, I love you, son. And having that role model, someone to say, hey, this is what you can be. And I never had that, and then my little brother, I felt like along my life or through my life, I had to somehow pivot to becoming that example of what a man should look like and what it takes to be a man. You know what I mean? Because my dad, I always say to like I grew up saying that, hey, if it could be when I grow up, half of someone not like him would be great. Because not that he wasn't just there, he was very physically abusive to myself. And it was very tough. And a lot of people don't know that because, like, oh, Colin, you ever been through that? Yeah, I actually have. But what I do, I used those very rough experiences as a child to really coil and make me into the strong person I am today. Honestly, I am grateful for all the experience because it came through very handy in situations in life I didn't know that I could be strong enough to make it through. But those experiences really helped.
Wow.
Yeah.
So in essence, then I guess what I'm drawing from you, several different conclusions I'm drawing here, right? Dad is there, but he's not quite there.
I know.
Different facets of your life that you believe that he should be representing in, he's lacking in those areas. And mom is taking on several roles.
Everything.
Do you plan on having children?
Oh yes, that's the plan.
And have you thought about what you went through and how do you plan to make it different for your children? Let's say you have a son.
Yeah. I'm happy you said that because I've always said it. I was saying to my wife today, hey, because we're talking about kids, And I was like, you know what? I actually want to have a son because I want to just give him all I didn't get. I feel like for the generations of Sewells in my life, it's always a series of abuse to their sons. And I was like, I'm gonna break that. I'm gonna have to break that generational curse and hey, chart a different path. One that does not look like this or feel like that. So it's just I know what it was missing, and I'm gonna make sure that my son or my kids don't ever feel like that. I literally remember growing up telling people my dad is dead. My dad is dead since I was 2 years old. I remember my dad found that I was telling people that, and he had a big old fit about it. And I remember saying to him, and that was the first time I ever stood up to him. I was like, listen, nobody throws away $1 million. If you were that much of a person, I would not be saying you're dead.
Wow.
You know what I mean? We didn't take it too well, but that was the one time I remember just really just having the courage to be like, hey, enough is enough.
Right.
Yeah.
Have you forgiven him?
I think I have. I really think I have. Do I talk to him? No, I don't. But I think I have forgiven. I had to forgive him to move on and not have nightmares. I was literally having nightmares all through doing my undergrad studies, doing pre-medicine. I was having nightmares, and that's not normal because at that point I was in my late teens. So it was a very traumatic. I remember just going to church and really talking to like pastors and priests about it and really seeking counseling, which really helped. And also using my platform to talk about abuse and how it can affect kids. And I feel like just by doing that, it allowed me to somehow made peace with it. And I have forgiven him. I have forgiven him for sure.
Wow.
Yeah.
That's a hot topic, mental health. And
Yeah.
certainly I'll dive into that with one of our guests that coming up, because certainly mentally you had to have been affected
Yes.
and you found ways or strategies to overcome. So there's an element of resilience, right? Where did that, I know I said earlier about the people who we grew up with from that same high school, as keeping in touch with several different friends now from Titchfield High School in Port Antonio. And they're some of the most resilient, determined, just driven people that I've ever come across. And they're somehow in their own respect or right, blazing their own individual trails. And that's something that I want to dive into deeper to see what is creating the characteristics that was in my cohort and probably in yours.
Yeah.
And if it's still there, what is doing that? Because certainly it's having an impact.
Yeah.
But I want to get down to the granular layers to see what is driving that, because maybe there's some lessons that we can extract, teach, help people to learn. But definitely that's a topic that we'll be diving a little bit deeper into, mental health. Here's a question that I'd like to ask for you as we kind of like get things wrapped up here a little bit. So we've talked about quite a bit of things. For like when you're not studying or preparing for a chiropractic sort of work, like what do you like what do you and your wife do?
Oh God, we're at Atlanta Carnival. We're at so we love to have a good time. We love the Caribbean culture. So wherever we can find that, we are there. So we're either that or just being at home watching movies and really just having some downtime. Because,
What's your favorite Jamaican artist?
Lord, my brain's going now. What's my favorite Jamaican artist? God, I can't say that. It's Spice. I like Spice. I love Spice.
I would have never expected Spice.
I love Spice. For a story though.
Yeah, for a story.
Or stories.
Well, I'm going to be quite honest because I'm laughing because I love Spice. Don't judge. Don't judge. Spice. The reason why I like Spice as an artist, yes, say what you want to say about her songs and the language. Her and Vibes Cartel, they're in a whole different category because, yes, you're going to have some heavily, sexually charged, language and lyrics. But when you see her, when you understand her grind, when you understand her story, her struggles, and what she went through, then you truly understand sort of what she's producing and why she's producing. Again, another amazing, a Jamaican who's trailblazing, but doing it in their own way.
Yes.
And I think if there's anything that I want to share with people as we conclude this segment is, as a Jamaican man, and we have a lot of Jamaican friends around us. There's some inherent characteristics that people oftentimes use to define, and I find them to be accurate.
Yeah.
Yes, Jamaicans have 5 jobs. I don't know how you're able to squeeze 5 jobs in a 24-hour period,
Yeah.
but they do it.
Mm-hmm.
Some of the most ubiquitous people that I've come across on Earth, when you go to the North Pole, when you go to Alaska, like in the depths of the tiniest place in some sort of weird village, a Jamaican is there.
Boy, they're there.
I just can't understand why these people are like this. But therein also lies, who they are, right? The drive, the grit, the determination, the stick-to-itiveness. And if there's something that I think that is awfully familiar and similar about our stories, is our path, our journey. I'm excited as a young provider, looking at you as a young provider.
Yes.
I'm excited about your future.
Appreciate that.
Why? Because I believe that you at this stage have the ability to navigate whatever you want to create. Your dreams should be so big at this point that they make you uncomfortable.
They scare me.
There should be nothing that you can't wrap your mind around and say, I'm going to accomplish this.
Yes.
And it stops you because, again, we are from a different sort of, a breed, if you will.
Mm-hmm.
You say no and we'll get it done. Whatever those dreams are, I won't ask you to spill them out now. But understand that, young professional, this show is about discovery, but also from an advice standpoint. Whatever the plans and the goals and the dreams that you have, now is the time to lock in. The next 5 years, the next 10 years. Set the foundation, have a clear, crisp goal, and make sure that every day your actions, your encounters, your every move should be purposeful at this point. Dr. Smith, Dr. Sewell, rather. It was a pleasure.
It was a pleasure being here.
Thank you for coming, man. And again, my youth, whenever you do jerk chicken, oxtails, and curry goat, please tell the wife that never pull up.
Will do.
All right? You don't know my youth.
Appreciate it, man. Thanks for having me.
Guys, yeah, man.